Hi, I am Liz Cortez with Business Trends TV, and today I am joined by Dr. Emil Chynn from Park Avenue LASIK. Hi, Dr. Chynn.
Nice meeting you.
Great. Thank you so much for being our segment today. So Dr. Chynn was one of the first eye surgeons in the New York tri-state area to get LASIK himself. So this was back in 1999 during the dark ages of laser vision correction. And Dr. Chynn is a firm believer that you've got to practice what you preach. Isn't that right, Dr. Chynn?
Yeah, our center is known for having everybody here having lasers. So from the secretaries to the staff, the other doctors who work with me and myself, we all have laser vision correction ourselves.
That is excellent. And I know that you have been a part of some cutting-edge technology and helping Dr. Waring develop LASIK, correct?
Yeah, when I was at Harvard, it was invented, and I've refined it over the last 10 or 15 years. So now it's a safer procedure and also more comfortable than the PRK it replaced.
That is great. I know that you are also on cutting edge of fixing night glare and halos that some people experience during procedures.
Well, intrinsic to the LASIK procedure, you have a little bit of night glare and halos. It's because when you cut the flap and you put it back, the flap never fully heals, so you have an interface. That causes some glare at night. I had the problem with night glare and dry eyes, so I switched to LASIK about 10 years ago. And since I switched, my patients really aren't having those problems anymore.
Well, that is excellent. I had LASIK as well, and it is exciting about this new procedure, and I'm excited to learn more about that. Now, I know that lots of the viewers that are watching this video right now are going online. They are looking for someone to do their vision correction. So what advice would you give to them when they are searching online and they are choosing the best person to do their procedure?
A lot of patients look for board certified. That's kind of a minimum thing. Most people are board certified. They really should see if the person did a fellowship in cornea and refractive surgery. Very few people have done a fellowship, and I would say most of the doctors doing laser vision correction never spent the 1 to 2 years just specializing in laser vision correction. I would say they have to have experience. It's not the easiest procedure in the world to get perfect. When I started out, getting people to 20/20, that's pretty easy. Now I'm getting more than half of my patients actually better than 20/20, which is amazing. I think it takes maybe 1,000 cases under your belt, so the patient really shouldn't be hesitant to ask the doctor how many LASIK or LASEK cases he's done. If they're uncomfortable, they can always ask the staff that question.
That's excellent. Now, when choosing someone to work with, what is your advice around their quality of service and how it is around the office? What advice would you give to them?
What's your question again specifically, Liz?
So when someone is choosing, they find a great doctor that has been to the fellowship or they've got a great experience, a great staff. What is the #1 piece of quality of service that you think is most important when choosing a LASEK or LASIK vision correction center?
Well, I would go to a center that only does laser vision correction. There are many doctors who do, let's say, 90% of their work is cataract surgery, 10% is laser vision correction. You might as well go to some person that's all they do, because by definition they'll have more experience, they'll have more attention to detail, and the pitfalls that can rarely happen. I would make sure that they offer a wide variety of procedures so they give the patient some choice. I would also say that it's very important that the doctor sees the patients before and afterwards. There's some centers like the chains. You don't meet the doctor until the day of your surgery, which is a little odd, and it's not probably something you would be comfortable with if you were having something else done, like, let's say, a nose job. So the patient shouldn't think it's just a laser doing the work and it's an automated procedure. The surgeon's very, very important. Just like any surgical procedure, they have to meet and get along with the doctor beforehand.
Oh, that is great, Dr. Chynn. Meet the doctor beforehand, make sure that you're able to get a hold of them and meet them for a consult, so that you can trust and know who you're working with. So I would love to know what type of experience would someone coming to Park Avenue LASIK have working with you and your staff?
Well, we have the largest LASIK center in the country, so many doctors are doing LASIK. We're the only center that exclusively does non-cutting. That's actually why we're the only operating room that's all glass. So every procedure on the sidewalk, people can watch me do the procedure. It's really just because when I was doing LASIK, you know, 1 in 1,000 you have a bad complication with cutting the flap. Once I switched to 100% non-cutting, we got rid of the flap thing, then there are no complications. So it's a very open environment. We don't separate the post-ops and the pre-ops. We do encourage them to talk. We even buddy people up. In other words, if you come in with, let's say, a lot of astigmatism and you're concerned, we'll buddy you up with a previous patient that we lasered with high astigmatism. They could talk one-to-one without us. And I think the patients appreciate that, and they trust it because clearly that other patient has no financial interest to convince them to get lasered.
Wow, that is great. That's definitely going above the fold and, you know, pairing them up with someone that has had the same procedure and has similar circumstances before they got the procedure done. So that's excellent. So I know that you have something very special for people who come and see you and give you a call. So why don't you tell us more about that?
Well, for the special with the business TV, if they come in and they mention where they came through, we have a package that's high definition. And by that package, we can laser the prescription 25 times more accurately than glasses or contacts. So before, let's say your glasses or contacts, your prescription's like -2 or maybe -225. There's no prescription in between. The laser can go 226, 227, 228. So with the high definition technology, I can put 25 different prescriptions on each eye, accurate to the 100. It's much more accurate than glasses or contacts. So with this HD option, we're getting more than half the patients better than 20/20. So if they come in and they mention how they came in, they can get this $1,000 upgrade for only $500. We also have something called Platinum where the recovery is quicker. Same thing, usually it's $1,000 option. As long as they mention they came in through this business TV, then they can get it for $500.
Wow, that is excellent. We'll have all those details right below this video. So right here on my screen, you can see there's the phone number to give them a call, take advantage of that, and then also a website, Park Avenue LASIK, right there. And then you just click the link below to get in contact with Dr. Chynn and his team. So I just want to thank you so much, Dr. Chynn, for doing this interview segment. I had a lot of fun. I learned a lot. I know that the viewers that are watching this definitely learned a lot too, and especially the difference between LASIK and LASEK. And so thank you so much for being on our segment today.
You're welcome. Thanks a lot for having me, Liz.